That's right. Topic of the day, we're talking about intimacy after breast cancer. And who better to talk to about it than a doctor and two survivors. So we'd like to say a very good morning to Dr. Azura, who is a consultant medical oncologist at Beacon Hospital. We've got Rohaida here, who's a breast cancer survivor, and Mary Chua, who's also a breast cancer survivor. Good morning, ladies. Welcome to the show. First and foremost, thank you very much, ladies, for coming here to speak up and open up, and especially to our viewers out there who probably are undergoing the same thing that you've undergone. But before we start with our wonderful survivors here, Doctor, can you please tell us, breast cancer, what happens after? If you've had a mastectomy, let's say.
Sure, of course. There are breast cancer treatment, is not only just surgery and other treatments such as chemotherapy and radiation and hormonal treatment. But when you talk about mastectomy, you're really talking about a surgical process where you have the breast shape changed, size change, or even a scarring that occur. So certainly that will affect the woman in the way they perceive their body image. I mean, they will certainly be affected by more body image issues.
Sure.
When they had
surgery.
I mean,
undergoing it is tough enough already, and to know after that, what your body may look like. Would you recommend counseling for these kind of things? Well,
yes. I mean, counseling in a way means preparation. I mean, certainly before they start their treatment, they should be involved and get as much resource and information as they can by not just, of course, talking to the provider, the doctor treating you, but also talking to other patients who have gone through the process.
Sure.
And I absolutely think that is the most important thing to prepare, to get the support and prepare yourself mentally and hopefully psychologically and emotionally before you actually have those changes occurring in you.
Well, let's turn the questions to Rohaida and Mary. How long have you been a survivor of breast cancer for?
I had it 4 years ago.
Okay.
And I had a recent recurrence. So
now you're undergoing treatment again?
I'm done with my treatment, so I'm back to...
Very brave for you sitting down here and sharing this with us. So breast cancer, I mean, what happened to you after? I mean, after you undergone your first chemo and you were fine, was it easy for you to go back and, to the humdrum of life and still have the feel attractive and all that kind of stuff? Can you please tell us?
I think for me, I did the lumpectomy first.
Okay.
It was a small surgery, and subsequently I did a mastectomy and reconstruction. The emotional effect was when I found out I had to do mastectomy. But post-mastectomy, when I found out that I had cancer, the effect was not it was not as emotional as finding out that you had to do mastectomy. So I believe it is an important thing to lose a part of women's pride, so to speak. Yeah.
Of course.
Yeah. So that's.
And how did you pep yourself up to, or rather, what did you have to do to make sure that you still remained, calm and composed and sane?
I think once you go through that emotional bump or hump, then you really have to take a step back and think, what is it that's important?
Right.
Do you want to die before your death, or you want to live your life?
The bigger picture.
Yeah, so you have to make that choice and really plan what you need to do. And for me, we have access to a lot of information. You do research of the effects and how to cope with it.
Sure.
And especially the most important is the support system that you have. Your husband, your family, that is the most important, and your colleagues. Those are very, very important for you to cope.
Okay. Mary, what's your journey like?
Basically, I'm a survivor for 5 years.
Okay.
And I basically, my surgeons was Dr. Sushila Nair. And I had the mastectomy. Yeah.
Okay.
So because when I was found out that I have cancer, and then advised by my surgeon that I had to get it removed completely.
Okay.
It was a shock. It was a shock, and couldn't see clear where my future from there for that very moment. And of course, and I had a very supportive husband. Family was wonderful. I have a good family and children as well. So when I noticed that I had to go for mastectomy, I said, okay, remove, because I don't want any foreign object with this. I consider cancer to be in my body. I want to get it out. I want to get it out as soon as possible. So I had it done. And the whole procedure it was so amazing that I thought that I will face a lot of pain after surgery. It was amazing. I don't feel any pain at all.
Okay, that's good.
It was so amazing. I don't even have to rely on a painkiller at all, even after surgery.
Wow.
You know,
okay.
I can't explain why. So that to me is nothing to be feared about. You know, when you had to get it done, you get it done. Basically,
like Rohaida, you looked at the bigger picture.
Yeah, I looked at the bigger picture, and I think that with the support systems and with you, I think all us basically will have to, if you're given the right information, the right knowledge, you will not treat cancer as a death sentence. You will think that it is just a part of life, that you will just have to slow down all things and to enjoy life, take one day at a time.
Right. Everything happens for a reason.
For
That's how you look at it.
Yes.
Okay, very interesting. Now, coming back to the topic of the day, Doctor, maybe you can tell us, you know, we're talking about intimacy here after undergoing breast cancer, undergoing either mastectomy or the radiation or the chemotherapy. Many ladies out there will probably be asking the same question: is it possible to have intimacy after? Your thoughts?
Okay, so I think it's important to, first of all, know that breast cancer treatment is highly complex. Patients will go through a very busy time in their life. You had surgery, then you have chemotherapy, you have radiation therapy, and endocrine therapy if you're a certain type of breast cancer. And the treatment will go on for many weeks and months, actually years even. I mean, treatment can be to 5 to 10 years.
Yeah.
And the sexual issues will not go away. It will be there. It's like the big elephant in the room. Is that a problem? But people won't talk, might find it difficult to talk about. And so, you know, there are many reasons why patients will be affected. The intimacy aspect will be affected due to treatment. So, I mean, we talked about how body image issues affected, and that's quite obvious. And chemotherapy, for example, patients will lose their hair, and that will, you know, you will feel less feminine and less sensual.
Your self-confidence, your esteem.
Yes, absolutely. And they feel tired and weak, but those side effects are temporary. And it's obvious when you are on hormonal treatment, like the tamoxifens and the aromatase inhibitors, patients will have reduced sexual desire or libido, and they also would have some changes in the vaginal area, such as dryness and atrophy, which can cause intimacy a little bit difficult and painful and less desirable.
Okay.
And you know, radiation is just a local treatment, so they will get better in time. And so it's very, there are so many ways how the cancer treatment can affect the patient. So it depends on where you are in your treatment journey. You should bring it up to your doctor. Essentially, it would be the treating doctor, and usually an oncologist like myself.
Okay.
And you know, again, female sexuality is difficult. It's not just the chemicals. I mean, men had Viagra for 15 years, and female, actually, in August of this year, the FDA have approved a drug which changes the chemicals in the brain, but that's why it took so long to approve it, because it's not just chemicals, actually psychological aspects of it which require teasing and time. You know, it's
to find out whether it really works.
But talk to your doctor first. And I mean, is there any physical things can be changed? Is it body image issues? You can talk to women, actually.
What is your, I mean, based on experience, you know, what is the most feedback you get? Is it the body image, or is it just their feelings and their mental attitude towards stuff? Or it's a combination of everything?
Many things. You know, the problems can come from physical, emotional, psychological, and even interpersonal. So it depends. And I think the most obvious one would be the changes in the genital areas, which could be done something about.
Okay.
Quite simply, I mean, things could be done to improve. And the psychological and emotional issues will take time. And that's when the interpersonal relationship, especially to your support systems, which I think has been mentioned, your partners, your husband. I mean, I have to say that in general, the Malaysian man has been very, I guess, not as I thought. They will be very understanding, and in fact,
to the Malaysian men out there.
they are in fact worried or scared that will cause hurt to you, and they might put their needs behind yours.
But they've been very understanding.
So there can be miscommunication because this issue is so difficult. It's personal. It's not easy to talk about. So you know, you talk it out. You know, you have to restart. It's very individual. Is that right? I mean, I cannot prescribe how your ABCs of how to get, but you know, there are ways. And even if you don't find it easy to talk to health professionals, you should reach out to other friends and breast cancer survivors
to find out what they experienced.
What helped, and there is now online support. There's discussion rooms.
Support groups are very
chat
important.
rooms. You know, if you want to be anonymous, you can help from all over the world.
Yeah.
There's plenty of stuff on the internet. There's lots of books been written down. But, you know, of course, you should speak to a professional. You have to get talking. Talk to your doctor, because, I mean, there's so many things in cancer treatment aspect that we would talk about.
Yes.
Your side effects, why we're doing this treatment, how you're getting on. And certainly, you know, down in the list is your intimacy.
Yeah.
So you need to get it out.
Rohaida, did you talk about it? Was it a big issue for you and your husband?
Yeah, I talked about it even before the treatment because I wanted to be prepared.
Okay.
So I talked to my doctor a lot. I talked to my gynecologist a lot. And most importantly, you must talk it out with your husband because, like Dr. Azura said, he will put his need behind whatever that's happening. So you must have that conversation.
But it's also super important.
Yeah.
So how did you manage that? I mean, like, what did you talk about? How did you feel after your procedures and everything? And were you just like, you had no desire whatsoever? What was it like for you?
I think in terms of desire and all that, there's a lot of ways to overcome that, and your gynecologist should be able to help you. And but most importantly, you know, you cannot be. You must have that open communication. Like he cannot think that you're so fragile. He cannot touch you. You know, and you at that moment, if before this he says, "You're not a beauty." I know I'm not a beauty queen, but I just want to hear him saying you're beautiful at least 5 times a day.
That's support for you, right? That's good support.
It's reassurance, you know.
Of course. Every woman needs reassurance,
Yeah,
you know.
so that's important. Little thing, you know, the way he looks at you, you know, makes you feel not less of a woman. I think that's important.
Okay. Mary, what about you? I mean, you know, as you said, you know, it was tough for you going through the mastectomy, and you know, how did you feel? I mean, body image-wise, you know, when your partner sees you after the procedure and stuff, and how did you get the intimacy going back on again?
Yeah, basically, if you stand in front of a mirror, you feel the impact, because that is where you see the actual lopsided, because it's half.
Sure.
Yeah. So basically, it's not just flat, but the chest will be sunken in.
Okay.
So people, I think it speaks of all women's breast is part of represent a woman's femininity. So it's like if you are not being assured of by your loved one that life itself is more important, then that kind of self-esteem you will have to really working very hard.
Yeah, so it's not really about the body image, it's about a bigger aspect.
Picture,
you want to live, you want to enjoy life, as you said, right?
Yeah, start living.
Start living.
Yeah.
I mean, it's funny how when things like this happen, then you take a step back and you realize, what is important and what is not. Before we wrap up this chit-chat session, is there anything you'd like to say to the women out there, Doctor?
Well, okay. I mean, intimacy is not, don't think it's as taboo. It's every woman deserves a fulfilling and loving relationship.
Absolutely.
And, you just have to get talking and there will be help out there, seriously. Start with your doctor and take it from there, there's so many possibilities, so you need to start somewhere. We'll try to tease it out for you.
Okay.
And he can, right, girls?
Yeah, yes.
Well, Rohaida, what would you like to say to our audience out there?
Yeah,
for those especially who are going through breast cancer.
Women sometimes get their priorities wrong. They don't want to do a mastectomy because they fear the after effect. But please get your priorities right. And cancer is not a flu. Get proper treatment, see the doctor, and go through it.
And you can survive it. I mean, look at both of them.
It's improved. Don't be shy. Don't deny yourself the right treatment.
Do you get a lot of women who just refuse or are in denial and all that kind of stuff?
We do, and with less desirable outcome, and we don't want that. So please get treatment. The earlier, the better, before it becomes too late.
Okay, okay. And Mary, what about you?
It's the same thing to like these two ladies as mentioned earlier. And basically that if you have right informations and sharing out, don't keep it to yourself, and talk to people who has gone through, that rest assured that your surviving rate will be higher. Yeah.
And you're not alone in
You're
this
not
whole
alone.
entire process.
We are the warrior. We're not victims.
Yeah. And very openly, you talk about it, whatever it is, whether it's the emotional aspect, the mental aspect, the physical aspect, you're willing to share and talk about it, right? I mean, it is the #1 killer disease for women in the country, but, right?
Yeah. And you don't choose to have the cancer. The cancer, nobody knows.
Yeah,
absolutely.
It's common. It's not your fault.
Well, thank you very much, ladies, for coming out and sharing all this with us. Thank you so much. And, we'll hope to get you back on set, inspire other people another time. Thank you. We're going to go for a short break. And when we come back, we're going to be talking to a youth to talk about how youths help the community and get the youth off the streets. Stay with us.